All right, hello and welcome. Today we're diving into something called gestational trophoblastic disease. Now, I know that's a mouthful, but it's a really important topic because it shows us just how incredibly complex pregnancy can be. So let's jump right in. We tend to imagine pregnancy as this pretty straightforward A to B process. But what happens when it doesn't go according to plan? What if the very cells that are supposed to build the placenta, the life support system for the baby, start to grow in a really abnormal way? That question is at the absolute heart of what we're talking about today. Okay, so first things first, let's define what we're actually dealing with here and break down the main types of this rare complication. So, gestational trophoblastic disease, we'll just call it GTD to keep it simple, is basically a group of rare tumors. And they come from these specific cells called trophoblastic cells. The best way to think of them is like the construction crew for a new pregnancy, right? Their job is to build the placenta. But with GTD, something goes wrong, and that crew starts building, well, uncontrollably. Now, it's really important to know that GTD isn't just one thing. It's more of a spectrum, and it's split into two main groups. You've got the premalignant types, which are way more common, and that's what we're mostly going to focus on, complete and partial molar pregnancies. Then you have the much rarer malignant forms. But to really get a grip on any of this, we've got to go back to the very beginning.
And when I say the beginning, I mean the very beginning. We have to rewind all the way back to the moment of fertilization, because that's where the initial genetic hiccup happens.
Think about it this way. In a normal, healthy pregnancy, the genetic math is super simple. You can picture chromosomes as instruction manuals. The egg provides 23 manuals, the sperm provides another 23, and boom, you've got the complete set of 46. It's the perfect blueprint to build a healthy fetus.
Okay, so this is where things get a little different. In a molar pregnancy, that genetic math gets messed up. Let's look at the two main ways this happens. First, you've got a complete mole. This happens when an egg that's basically empty, it has no genetic material, gets fertilized. So all 46 chromosomes end up coming from the father. With that blueprint, a fetus just can't develop. Then, on the other side, you have a partial mole. Here, a normal egg gets fertilized by 2 sperm. So instead of 46 chromosomes, you end up with 69. That's a condition called triploidy. Some abnormal fetal tissue might start to grow, but unfortunately, it's just not viable.
So, if the whole genetic blueprint is wrong right from the get-go, what does that actually look like? How would anyone even know something's wrong? Let's talk about the signs and symptoms.
In the beginning, the signs can be kind of tricky because they can look a lot like other pregnancy issues. Things like vaginal bleeding or some abdominal pain. But there are a couple of major clues that point specifically to a molar pregnancy. One is that the uterus is growing much, much faster than it should be for that stage of pregnancy. And another really distinct sign is the passing of these small grape-like vesicles. That's actually the abnormal placental tissue itself. Now, if it goes on for a while without being diagnosed, some other pretty intense symptoms can show up. And what's fascinating is that these aren't caused by the tumor getting bigger. No, they're caused by the crazy amount of the pregnancy hormone, HCG, that this tissue is pumping out. Yeah, this abnormal tissue basically turns into a hormone factory, just churning out massive quantities of HCG. And this hormonal flood, it can cause some serious issues. It can lead to something called hyperemesis, which isn't just morning sickness, it's severe nausea and vomiting. It can also kick the thyroid gland into overdrive, causing hyperthyroidism, and can even lead to anemia. Okay, so with all these potential symptoms, how do doctors piece it all together and figure out for sure that it's GTD? Well, it's kind of like a multi-step investigation. The very first clue, the big one, shows up in the blood work. So HCG, the pregnancy hormone, is always elevated in a normal pregnancy. But with a molar pregnancy, we're not talking just elevated, we're talking sky high. Levels often shoot way past 100,000. A number that high is a massive, immediate red flag for any doctor. All right, so the next piece of the puzzle is the ultrasound. And for a complete mole, the image you see is pretty unforgettable. You're not going to see a developing fetus. Instead, the screen is filled with this unique pattern of cysts. It's so distinct that it has this famous description, a snowstorm appearance. It's a really powerful visual clue. So you've got the blood tests pointing one way, the ultrasound showing a clear picture, but the final 100% confirmation, that comes from looking at the tissue itself. After the molar tissue is removed, a pathologist examines it under a microscope. That super close-up look is what gives the definitive answer and confirms exactly what type of GTD it is.
So, that leads us to the most important question, right? How is this treated? And here's the really good news. The treatment plan is incredibly clear and effective. It leads to a great outcome for the vast majority of patients.
The whole process is very structured, very methodical. Step 1 is getting referred to a specialist GTD center. These are the experts. The main treatment is a procedure called a suction curettage, which is a gentle way to remove all that abnormal tissue. But then comes what is maybe the most critical part, the follow-up. Doctors will carefully monitor those HCG levels all the way back down to 0. This is to make absolutely sure no abnormal cells are left behind. And in some cases, if those levels are stubborn and don't go down, a course of chemotherapy might be needed.
And I really can't stress this enough, that follow-up is everything. Sticking with those blood tests for several months, watching that HCG number stay at 0, it's the only way to be totally certain that the condition is resolved and that it's not going to stick around or, in very rare cases, turn into something more serious.
So if there is one single thing you take away from this explainer, let it be this. I know this all sounds really complex and honestly pretty scary, but gestational trophoblastic disease is one of the most curable gynecological cancers there is. When it's handled by specialists, the success rate is incredibly high. It's a real medical success story.
And that really brings us to a bigger idea, doesn't it? Digging deep into a rare condition like GTD has taught us so much and led to these amazing life-saving treatments. It just makes you wonder, what other secrets are hidden in the rarest of medical conditions that could unlock better care for all of us?